Historically, the only way to improve the lives of more than 1.6 billion people in the US who live with tricuspid regurgitation was open heart surgery. Countless people with this condition, like Gregory, are unable to withstand surgery due to the age or other health conditions, and were previously left with no other option but to wait for their heart to fail. Now, today, I have Gregory, a Vietnam veteran and retired member of the U.S. Air Force. I also have to have Dr. Nadim Gilo, if I'm saying it right.
Nadim Galoo.
Galoo, thank you. Nadim Galoo, Senior Medical Director of Abbott's Structural Heart Business. Good morning to both of you.
Good morning, James.
Good morning.
Morning. Doctor, what is a leaky heart valve and what are some of the symptoms?
We have 4 heart valves, and the way they work is they allow blood to go through in one direction only. They're one-way valves. A leaky heart valve occurs when the valve's not working properly, meaning the leaflets of the valves are not coming together and blood leaks and goes backwards. When that happens, you can get symptoms of swelling in the legs, swelling in the abdomen, poor appetite, difficulty sleeping. Some folks have difficulty breathing when they exert themselves. And folks simply are not able to do the activities of normal everyday living, such as climbing up the stairs without having discomfort. And it really affects folks' quality of life, and this is why the Abbott TriClip device has been revolutionary.
So, doctor, how have patients with a leaky tricuspid, if I'm saying it right, valve been treated historically?
Historically, the therapy was open heart surgery. However, it was not a therapy that was offered very often to patients because this group of patients often has risk factors that places them at an increased risk for complications from the surgery or poor outcomes from the surgery. As a result, the majority of patients were being treated medically, and what that meant in most cases was diuretic therapy, which itself has quality of life issues because you have to be close to a bathroom, you're urinating very frequently, and in many patients, this therapy wasn't enough to get them feeling the way they wanted to feel. And this is where the minimally invasive TriClip therapy comes in. The Abbott TriClip device can be delivered simply through a puncture in the skin using the vein in the leg. And this allows doctors to access the heart with a catheter and deliver 1, 2, or 3 devices right at the site of leaking of the heart valve to repair the valve. This is the first of its kind, minimally invasive repair therapy for the heart.
Now, Gregory, you're a Vietnam veteran, a retired member of the U.S. Air Force. Your passions are Tai Chi, golf, and traveling. So tell me this. Your quality of life was compromised due to this condition. Tell us what you're experiencing what you were experiencing before receiving this treatment.
Yeah, practically my whole quality of life was compromised. I've always been a very active person. I wasn't able to perform like I wanted to, things like golf and Tai Chi, things you had mentioned. In addition to that, I was having a shortness of breath, very fatigued, wasn't able to sleep very well. I started retaining water in my abdomen and just basically suffering. So having been a heart patient for several years, I went to my cardiologist, told him what was happening. He sent me to have some testing done. The test results came back stating that I had tricuspid regurgitation. Because of my age and my health history, it was too risky for me to go through another open heart surgery. And he told me about a clinical trial that was being performed using a device called the Abbott TriClip. So I actually went to see the doctor who was leading the trial. I qualified for the surgery. I had the surgery scheduled. I went in, had the surgery that morning. I was transferred to a room later on that afternoon. Later on that night, I was actually up and walking around the hallway. And the next day, I was actually discharged from the hospital and went home.
How soon after receiving the device did you notice a difference in your symptoms?
Almost immediately. When I started walking in the hospital corridors, I noticed I wasn't as short of breath. When I got home, I started walking the hallways of my home, and I was able to gradually doing more and more minutes. I started off with 5 minutes, and I kept pushing myself just about every other day for additional minutes. Within about a week and a half, I was actually able to go out and play 9 holes of golf.
So, how are you doing today?
Thanks for asking, James. I'm doing very well. My quality of life is back to what it was beforehand. I'm able to participate in all my activities and just remaining hopeful and thankful.
Now, doctors, tell us about the recent FDA approval of the Abbott TriClip and why it's significant advancement for some patients with a leaky valve.
The Abbott TriClip was approved by the FDA in April of 2024 and was approved based on the clinical trial results. Much like the trial results that, the trial that Gregory was involved in, which demonstrated incredible safety. 98% of the folks who underwent the TriClip procedure were free from adverse outcomes or adverse events at 30 days. It was an incredibly safe and effective therapy, and based on the trial results, the FDA approved the device, and it's available today. This device should be discussed with your physician. If you have any of the symptoms that we've talked about, such as what Gregory articulated, please talk to your doctor. This therapy may be the right choice for you, but the discussion always starts with your physician.
Now, doctor, where can our viewers go for more information?
Folks can go to abbott.com to learn more about the Abbott TriClip device, but also to learn more about other minimally invasive therapies that Abbott has developed to help patients with heart problems. And again, if you have any symptoms which are different than your usual state, please don't hesitate to reach out to your physician and discuss the various treatment options.
Doctor, you and Gregory, thank you so much for joining us on Morning Blend. And Gregory, thank you for your service.
Thank you very much, James. I appreciate that. Take care.
All right, you too.